Robby. Robby! Hello and welcome in. They call me Sour, and today we are watching The Pitt, Season 2, Episode 5, 11 a.m. If you are new to the channel, please take a moment, hit like, subscribe, stay a while. I don't really have a lot to say. I know, shocking, about last episode. I pretty much got all of it out last reaction. I do want to say, I am not sure if I am picking up themes for each episode that are like the point, or if it's just me making connections. But I am really enjoying how this season is going so far. I'm 4 episodes in, about to start number 5, and for the most part, I've really enjoyed this season. The things I haven't are few and far between. And with all that said, let's get going.
Cellulitis on the dorsum of the foot, now spreading up the leg.
That little slow blink
Robby.
that Langdon did.
I don't know that you're going to make it back to work today.
Oh.
Erythema and warmth halfway up her knee. When did you see her, Donnie?
He didn't, I did.
When?
About 4 hours ago, I gave her a dose of Keflex, told her to come back if things got worse.
Things have definitely gotten worse. Jesse, can you get her started in trauma 2 with some Vanco and blood cultures, please?
Got it, boss.
I'm coming with.
Suit yourself.
62-year-old male presents with chief complaint of left lower back pain. Consider the diagnosis of Jesus Christ.
Sorry.
Oh.
Did I do something wrong?
Besides interrupting me, probably.
Then I apologize.
Whitaker.
I know that second year of residency can be stressful, so if there's anything I can do to help you.
No, she just got threatened by Dr. Al, and so she doesn't know what to do with herself.
Or dissection.
Got a new one for you in 13.
I'm 20 charts behind, and the new attending is threatening to make me repeat a year if I can't catch up. Dana, please do me a solid.
Holiday weekend. Westbridge is down in our waiting rooms on overdrive. I'm sorry, but your charting's going to have to wait until after you're shipped. Ogilvy. Dr. Santos needs you to pick up a new patient in 13.
Yes, ma'am. I'm on it.
Uh-oh.
Try it while you supervise. Best I can do.
The way that Robby and Langdon both acted, I was going to say they both acted like bitter exes, but Langdon is not acting like a bitter ex. He is acting like an ex who knows he screwed up and he's trying to at least make peace. I understand Robby's feelings. I understand his anger. But my goodness, man. Whitaker is like doing his hardest to maintain a good relationship with Santos. He can tell something's off with her. I don't like that she was threatened by Dr. Al, and I don't like how she is reacting to being threatened. I don't know, maybe it is something she should bring up to Robby.
Staying here is going to cost more than we can afford. Look, I'm feeling better. I'll just leave.
Stop.
Mr. Diaz, even if your blood sugar is back to normal, we have to continue with the insulin drip until we clear the ketones from your bloodstream. Otherwise, you could experience electrolyte disorders, heart and kidney problems.
Your health is what matters.
I'll make you
Truly.
a deal. You agree to stay on the insulin drip, and I'll go find our case manager to discuss cost-cutting options for your stay.
Deal. And I'm sitting here making sure he doesn't move.
Good job, wife.
Sometimes the human body can have an overreaction to an infection, so we're going to monitor you to make sure that this does not progress.
She's scared.
It's my boss. Sorry, I have to take this or he's gonna fire me. Hello? No, I'm still at the hospital.
Yeah, and she's not coming back today.
I don't know. You want to talk to them? They're kind of busy right now. I know you are.
Second IV's in.
No, I'm not overreacting. My body's overreacting. Please don't fire me.
No.
This is Dr. Michael Rabinovich. I am the chief of emergency medicine at PTMC. If you fire her, she will sue you, and I will testify on her behalf. Okay. Don't worry about it. We got you.
Oh. I may be a little emotional. That was highly unprofessional. He should not have done that from a legal standpoint, from a professional standpoint. But from a human standpoint, from a moral standpoint, I love Robby so much.
Do you know how long Jack is going to be asleep?
So there's no exact timeline with the sedatives we gave him, but he should be awake soon.
Have you spoken to your parents yet?
Yeah, they're on their way back from Columbus.
Maybe you should take some time for yourself before they arrive.
You know, I just can't believe that a campus security guard tased my brother.
You have every right to be upset, and you should absolutely pursue accountability. But right now, we are taking care of your brother, and you should really take care of yourself.
I have your number. I'll text you as soon as Jackson's LP results get back, or if he wakes up.
I don't quite understand why they're telling her to go take care of herself. They haven't. It's 11 o'clock. Was he end of the first episode? So that would have been around 8 a.m. It's only been 3 hours. She got there the following episode, which would have been 9. She's only been there 2 hours. It feels a little off that they're telling her to go take care of herself, but it's not a big deal. It's just weird.
Mrs. Randolph, do you take Percocet every day?
No.
Huh. And what about your water intake?
Pause. Mrs. Randolph, you said you don't take Percocet every day, but when was the last time you took some?
Maybe 3 or 4 times last week. Assisted living had a ballroom dance competition, and I tweaked my back.
Any further questions, Ogilvy?
When was your last bowel movement?
I don't know. Sometime last week.
Oh, honey,
I've
no.
stopped up for at least 5 or 6 days. That's why they put me on a stool softener, and then they tried an enema.
And no movement?
Sip.
Let's get you an x-ray and see how we can help you, Mrs. Randolph.
Thank you.
Differential?
Okay.
Probable stool impaction, but with her history of cholecystectomy, it could be small bowel obstruction.
Or worse?
Sigmoid volvulus?
I am getting concerned. This is a millimeter past the line.
Or my line was sloppy.
Any increase in pain?
Why is he minimizing?
Just try morphine.
White count's only 10,000. It'd be over 12 for SIRS.
There are other criteria.
Still afebrile.
Did you ask about past history of MRSA?
Not specifically, but she's never been hospitalized.
Any evidence of an immunocompromised state?
No, she's healthy.
Steroid use?
Never.
Maximum heart rate's only 89.
Is that okay?
That's good.
Low.
Very good.
I don't feel like Robby's overreacting there. Like, for the patient. He's obviously overreacting for Langdon.
Hi, I'm Dr. Al-Hashimi.
Do you need a hand?
Nope, we got it.
Trauma 1. This way. Haven't seen you guys in a hot minute.
Oh, right, because of the other hospital. I almost forgot.
Yeah, you and everybody else.
Gus Varney, 54, victim of assault with diffuse blunt trauma. He's got bruising to the face, the right chest, 10-centimeter laceration to the left arm. BP's 136 over 84, pulse 102, good sats, 95 on Romero.
No
How
good.
you feeling there, Mr. Varney?
Fucking hurts.
Where?
Yeah.
Everywhere.
I am Dr. Robby. This is Dr. Al-Hashimi.
We'll get you something for the pain.
I've got a progressing cellulitis.
So, I'm good.
Thank you.
One of the fine upstanding citizens of cell block 6.
Oh.
Can we get the cuffs off once he settles?
Orange jumpsuit, he's cuffed for a reason.
My brain didn't register that he was a inmate. I wish they would take the cuffs off.
Okay.
Hold on. Go.
1, 2, 3.
Mel's look of frustration was beautiful.
Oh, weird bruise.
Ooh,
Got stomped.
Jesus.
broken rib.
Is that necessary?
Afraid so.
Good lung sliding on the left. Ah! Sorry. Good on the right, too. Pulse ox 97, BP 118 over 78, heart rate 112.
Who's that?
Okay, swollen mandible.
I love
Open
seeing
your mouth
them.
for me, Gus.
This feels like a
little wider.
team that's
And-
working together.
Whitaker, you know the tongue blade exam?
Yeah.
Sorry, Gus.
Positive test.
Yeah,
Okay, this redness is now a centimeter over that line, and this might be Ebola forming.
Vanco takes a little time to work.
No,
I got
I'm
it.
sorry.
How are you feeling, Betty?
Langdon is underreacting here.
I'm feeling a little warm.
That can happen with Vanco.
Lactic acid 4.2.
That can be a sign of a more serious infection, but the good news is we know it.
This is severe sepsis.
I know, but at 7 a.m. it was a simple cellulitis. We could add carbapenem and broaden our antibiotic coverage.
Okay, I got it.
What's going on?
We're adding new antibiotics.
It's serious.
We want
Yeah.
to get ahead of it and make sure it doesn't become serious.
It is serious. Don't minimize Langdon.
I think you've done enough. You can go.
I have no patience for the amount of peacocking that is happening in that situation, it does not serve the patient. It's making Langdon feel like shit. Robby is right to be upset at Langdon for the past, but that's not something to deal with today. And it's understandable that he's annoyed at Langdon minimizing. But there's a way to handle this, and I just feel like he's not reacting appropriately. He's acting from a personal space and not a professional space, and that doesn't work.
Keep me posted.
Ditto.
Yeah, I'm
How's it
shaking
going?
my head too, Robby.
Great. If you ignore the hot mess and chairs.
Any update on our little baby Jane Doe?
Security's reviewing the CCTV from last night and this morning.
I completely forgot about the baby. I just...
You two kiss and make up yet?
I think someone needs to smoke a cigarette.
So quit.
Why don't you quit when I'm on my trip?
Everyone's glad to have you back.
First of all, I'm glad to know that I'm not the only one that picks up on their tension. Thank you, Dana. And also, Robby, that was a low blow. Come on now. Come on.
Well, not everyone.
Diagnosis of aortic aneurysm or dissection, but the point of care ultrasound was
Done with that gridlock, Granny?
ordered an acute abdominal series.
Great. Then you're free to treat our latest and greatest in SAS-16.
Oh, come on, Dee. It's like every time I get a moment to chart, I barely get a sentence out before I get
interrupted. Sucks to be you, but trust me, it sucks worse for the poor gal in 16.
I'm beginning to think you enjoy torturing me.
Perks of the job.
Robby, let's go.
She just adopted him.
A little shaky.
I'm no surprised. I've been here since 4 a.m.
Oh, Louis.
We can get you something that.
Oh, I can take care of it myself if you cut me loose right now.
Yeah, I'm really worried about him
50
detoxing.
milligrams
I'll put in the order.
I will get it from the PDFs.
What just happened? What did I miss? I was focused on doing this. I got distracted. Are we going to get territorial over Louis?
4 a.m.
We can get you something that.
Oh, I can take care of it myself if you cut me loose right now.
Let's get Louis 50 milligrams of Librium.
I'll put in the order.
Yep.
I will get it from the PDFs.
Oh. Yeah.
I'm already assigned as Louis' treating physician. Just makes sense that I put it in.
Yeah, of course.
Oh, it's because he used to steal Louis' medication.
Any changes with our septic waitress?
Not yet.
But if you have a sec,
I don't.
Langdon cannot get upset about that. Like, he can't. His first day back? No. He has to prove himself. He will have to prove himself over and over and over again. And I'm sorry. Addiction is complicated. The impact it has on those around the person fighting, dealing with, struggling with addiction is complicated. And Langdon cannot be offended that people are hesitant around him and controlled medications or medications that could be abused. He just can't.
For both, I considered the diagnosis of Catacoina syndrome.
You writing a great American novel?
Oh.
Charting and supervising. It's Dana's idea.
Who is the lucky patient?
Okay, deep breath in, blow it out
I'm
real
nervous.
hard.
You haven't heard enough already?
I need to check for wheezing with forced exhalation. You smoke, Mrs. Yardley?
Yeah, but I haven't been able to for a couple of days because of this cough.
You ever consider quitting?
You ever considered minding your own business?
Yeah.
Well, the good news is that your test from earlier came back negative for both COVID and influenza, but I'm going to order a chest x-ray so that we can see what's really going on in those lungs. You got time to let us do that?
Where the fuck else you think I gotta
Why
be?
is he being so rude? The minute he is not supervised, he cops an attitude. Not happy.
When was she diagnosed?
7 years ago. Resected a lobe. 4 cycles of platinum chemo gave us a couple good years, but then it spread to the bones.
That's why you're at hospice at home.
Yeah.
I'm sorry.
Yeah.
Me too.
Oof.
You have kids? 2 boys. 15 and 9.
My son's 12.
Goes fast.
Yeah.
Too fast.
Oh, she was diagnosed 7 years ago. That means her youngest was 2. I can't imagine.
MS Contin, 30 milligrams twice a day, oxycodone for breakthrough, and sublingual Actic for when it gets really bad. A hospice nurse comes by a few times a week, but I was alone when she had the seizure. She couldn't breathe. I freaked out. I called 911.
No, that's valid.
So sorry.
Don't be sorry.
I'm sorry.
Oh. Okay.
It's unfortunately very common for people to fall between the cracks. It's an imperfect system.
Seriously.
Can PTMC help with the cost in any way?
We can offer financial assistance. You pay 60%, we cover 40%.
It does help. It's not enough, but it helps.
Where have you been? How are you doing?
I'm sorry, Mijita. You were being thoughtful. I just blew up.
Well, Miss Noel was just telling us that the hospital is going to
I
give us
can't
a
get over.
We can knock 40% off your final bill.
That's great. Mm-hmm.
For some, this is going to sound weird, but seeing a dad, more macho type man, apologize, and especially with that, he named what she was trying to do, where she was coming from, and he apologized. It's so good to see. And I don't remember this last season. I would have to rewatch it. But this season, we have had multiple moments of wholesome or positive or non-toxic masculinity. And it's just really needed. And it's really good to see.
She has to stay here to get better, right?
Yes.
No.
No?
Excuse me?
I mean, not necessarily. Couldn't we just admit him to med-surg instead of ICU? Wouldn't that be a lot cheaper?
Med-surg won't accept him with an insulin drip.
Usually true, but let me talk to the charge nurse upstairs. And I'll see what she says.
Thank you.
Okay. Mohan, don't get upset at Joy. She's trying to help your patient just like you are.
3 times in one day. To what do we owe the pleasure?
I came down for consults and to persuade Ahmad to start a new betting board.
Why is the Westbridge board full already?
I was going to ask him to start one about you and your midlife crisis trip. I give it 4 weeks. 7 tops.
You have little faith.
Not enough faith, just facts.
Facts.
Based on my experience, you're a 7-week itch kind of guy.
Oh.
Yeah.
Thank you, Perla. Somebody down here has a little faith in me.
Man can't stand to be alone for more than a few hours. He sleeps with the TV on in his bedroom.
Yeah.
I really don't think I needed to know that.
No.
Maybe he's looking for something new. We're trying to outrun some old ghosts.
Yep.
I hope he finds what he's looking for. Man deserves some peace.
Amen.
I considered the diagnosis of Cauda-Equina syndrome, but the motor and sensory exam were both intact in the
Our unhoused coffer has pneumonia.
I'm cursed.
You're not cursed.
What?
That is a cavitary lesion in the right upper lobe. Active TB. What's next?
It's too soon to be positive.
Yeah, but you were exposed. You need a baseline test, and then again in 8 weeks to see if you convert.
And if I do?
Then meds every day for 3 or 4 months with regular blood tests to check for toxicity.
Jesus.
All right, let Dana know what's up, and for the love of God, mask up when you move her.
Maybe they should be wearing masks all the time.
Dr. Langdon.
Hey, man, Alex.
Let's take a look.
Oh. Ooh.
Is it bad?
It's not good.
Perla.
What happened?
My jack off, brother. I asked him to do it, just not like this exactly.
What? Why?
He was gonna brand me like I branded him.
Brand? Like cattle?
Instead of hot branding, you stick the iron in dry ice, let it get super cold, and then you...
Please don't do that yourself.
Let's get some mud on this. I'll get some.
Oh, Perla.
Doesn't seem like Robby's all that happy I'm back.
Well, he's not going to be here, and I'm happy you're back.
Thanks.
That was nice of her, which makes me suspicious.
Roll him right side out.
Hey, we're gonna need the cuffs off.
Ready? And 1, 2, 3.
Gentle.
Yeah. Oh my God.
Dr. King, how are the chest and belly?
We have 3 anterior rib fractures and a small pulmonary contusion.
Good.
Okay, he's really hurting here. You think you could set us up with a serratus anterior field block?
The patient consents.
Mr. Varney, we want to give you a shot to numb your broken ribs so you can breathe easier.
Okay.
Please.
Mr. Varney prepped and draped. Dr. Mohan, you're in charge.
Cuffs?
I don't remember them ever being like, you're in charge before.
Man, he's clearly not moving on his own.
We follow protocol for his safety and yours.
Ignore it. Just ignore it.
Amen, sister.
Forearm is numb. We can irrigate. I wish I could ignore my deposition.
That you can't ignore.
I think I overstepped with Dr. Langdon earlier.
Oh.
He was trying to prescribe a patient benzos, and I told Langdon that it'd be better if I did it.
Oof.
Only because I was already the assigned physician.
No, it makes sense.
Yeah, now I feel like an asshole.
You're not an asshole. But I don't like that they're talking about this in front of a conscious patient.
Spiked attempt to 102, gave Tylenol. Check out her leg.
That is a definite bulla. Did surgery come down yet?
Not yet.
I thought it was just a little swelling because I'm on my feet all day.
Unfortunately
She's down to
not.
85/40.
Can someone please tell me what's going on?
Yeah.
Sometimes an infection can cause your blood pressure to drop and lower the amount of oxygen in your blood.
Am I going to be okay?
We're doing everything that we can to make sure that you are, Jesse.
And I don't like that she's alone. I want her to have family or someone show up for her.
You want me to call Langdon? No, I will be right back, and you can call surgery and tell them to get their heads out of their asses and get down here.
Stop giving him death glares, Robby.
Did you bring Langdon back here?
No, Al Hashimi did. You banished him to scub purgatory. He did everything you would have done with that cellulitis patient. If you think he missed something, tell him.
Open shoulder dislocation is back.
Westbridge shut down all their ORs, so they told us to bring him back here.
You joking? This ain't the Radisson?
Not my problem. Where should we park him?
Hey, so sorry about this ambulance tour of Allegheny County, Mr. Billings, but we got you from here, I promise.
Yeah, I'm starving. Is there any way I can get something to eat?
Sorry, not before surgery.
No.
Can I have a visitor?
Sure.
Can we get him some fluids, maybe?
Hey, you're kind of buds with Gloria. Did she say anything to you about what's happening at Westbridge?
No, you?
Nope. How are your patients?
Buds with Gloria.
Good. Quicker we can treat them, street them, move them up the food chain, the better.
Question. Why are you treating me like one of your residents?
I'm not. As the attending, I'd like to know the status of all the patients and doctors in the ED in case I need to jump in quickly.
Makes sense. Now your turn.
What?
As your fellow attending in our ED, it only makes sense for me to know the status of all the patients and all the doctors, in case I need to jump in on a moment's notice.
I don't actually disagree with her there.
So if you look at the bone here, it's pretty well aligned.
Sorry, hi. Hi, I was in the shower and I came as soon as I got Paul's message.
Lena?
Hi. What happened? To baseline mental status. I'm sorry, I'm confused.
Who are you?
Aren't you off duty? I'm Roxy's death doula.
Her what?
Yeah, death doula.
I help advocate for people like Roxy to make their transition to death a more peaceful process. It's like a birth doula, but for the end of life.
It's very cool.
Whatever you have to say about my condition, you can share with Lena, too.
We were just explaining that Roxy has a pathological fracture through a metastatic lesion.
Okay.
Can you fix that?
The treatment is immobilization and a long leg boot.
The bones should heal in about 6 weeks.
If I live that long.
No.
Holy shit.
Sorry, who are you? Concerned brother.
Brother.
Not too bad. You good at me? Yeah, it's nasty. Thanks to you.
Wait, you did this?
Oh, yeah, you want to see the video?
Why is there video?
All right, I'm getting close. Brothers unite!
Oh,
Dude,
God.
why in the world would you ask to have that done to you?
He was trying to brand me with our family crest.
No. You need to go.
Your family crest is the Penguins logo?
We were gonna be bonded for life.
You already are. With DNA.
I don't judge someone for wanting a body modification like a branding. Not for me, but I'm not going to judge. But don't do it at home. No. Go to a professional body modification. Yeah. There are people who train for things like branding and scarring and all of that will be able to make sure that it is done correctly and safely and will heal properly. Like, not at home, kids. Not at home.
Doc said it's gonna take some time, but it'll heal okay.
Awesome. So maybe we can try again in a couple of months?
No.
No. Okay, thank you.
She's not going to make it, is she?
Surgery here. Hello.
Hey, it's about time. Where's Garcia?
Yeah.
Stuck in the OR. She sent me down. What you got?
Septic shock, respiratory failure, and possible necrotizing fasciitis. She needs to go to the OR ASAP. The infection was isolated at the dorsum of the foot 5 hours ago, but now we're almost to the knee with
Oh my God.
crevitis and edema. You seen neck fascia before?
In a textbook. I was a med student 2 weeks ago.
Ooh.
Gotta show this to Dr. Garcia.
Okay, Jesus Christ. Go get anybody else from your service down here. Shamsi, Miller, Walsh.
I don't know any of those people.
Don't take this personally. I just need a fucking grown-up down here.
Which is understandable.
4 hands are faster than 2.
Whoa.
That just tore right through the skin.
Skin seems pretty fragile.
EDS?
Yeah, this is not working.
He has the skin strength of an 80-year-old.
Put down stair strips with benzoin, not across the wound, but along each wound edge.
Okay.
What say you, Dr. Robby?
Great. MacGyver move. Go for it.
6th Sense.
Does Dr. MacGyver work here?
Oh my God. No. I'm not that much older than them, and I feel old right now.
Relax. You can take the mask off. You don't have TB. At least not yet.
Oh, great. This is fucked up. How are you so calm?
Expected job hazard. 70% of doctors in training at urban hospitals get exposed to TB and wind up on meds.
Jesus, I don't teach you that in med school.
Perhaps you should be automatically taking prevention measures? Maybe?
Think of this.
Fecal material?
A shit ton.
Santos.
I spoke to the charge nurse in MedSurg. They can take Orlando today.
Yes, that's wonderful.
And 5 days on MedSurg is going to cut your hospital bill down by 2/3.
Yay!
I can't give you an exact amount, but roughly $35,000.
I'll still have to pay what, like 20 grand?
The hospital can work out a payment plan.
Orlando,
please.
We'll be okay. We'll figure it out.
You can't make more money if you're
I'll
dead.
take on extra shifts at the coffee shop. We got you, Dad.
My pleasure. The real thanks goes to the newbie here for thinking outside the box.
Woo! Good job, Joy.
Sorry I doubted your med surge pitch. How'd you think of that?
My family had to think of a lot of creative ways to help manage our grandma. System doesn't work for you, you gotta work the system.
Mm-hmm. Amen.
She died before my freshman year of college. Sorry. Her death taught me a lot, mainly that I don't want to be around people dying.
And then you get into medicine.
This should do the trick. Do you notice a difference?
Better.
Ah, great.
Good.
Great.
How does this thing work? Your very own morphine butler.
Though you'll need more equipment for the house now that she can't bear weight on her leg. And a hospital bed could be helpful too.
How do we get all that?
You
We're
don't.
at that stage.
I do. I will get everything so that the two of you can get out of here and back to the kids. At home.
Thank you.
Do me a favor, give me some 4x4s and some betadine.
Sorry, we're getting killed with transfers from Westbridge. Mesenteric ischemia, perforated bowel.
Got a hot one here.
Yeah.
Oh my God.
Neck fash.
Possible.
Need CT with contrast to
This is
confirm.
spreading like wildfire. By the time you get your CT, it's going to be up to her waist. She's going to need a hemicorporectomy.
She needs a CT scan.
How about stainless steel scan?
Robbie.
For Christ's sake. Rabinovich. Robbie, what the fuck are you doing?
Robbie.
Oh, God, I think it might be pure.
That's called dirty dishwater exudate without purulence. There's a gray appearance to the fascia, and in the OR, you'll see easy separation in the tissue planes.
When do you start your sabbatical?
Tomorrow.
Not a moment too soon.
Thanks for coming down.
Robbie. That was crossing a line.
Catching up on my charting as fast as I can.
Why don't you give my generative AI app a try?
No.
30% more efficient, and providers report increased job satisfaction.
Sure, AI will make doctors more efficient, but hospitals will expect us to treat more patients without any extra pay, of course.
What's the status of your septic patient?
Neck fash.
Oh, God, the look Garcia just gave him.
Right now, I'm just hoping they can save her life. Hey, how's Ogilvy doing?
A little TB exposure, a touch of asplosion. All in all, pretty good day so far.
Robbie
on now.
appreciates Santos's humor some days.
Watson Brew. You are the
No.
man.
Appreciate the bromance over here, but no food, because you might go into surgery. No beer, because we're a goddamn hospital.
Starting your sabbatical early?
I know somebody who could really use a drink right now.
In the hospital?
As a parting gift.
Louis. Hey, that worked pretty well.
How's it looking?
Good. The stair strips did the trick.
Had they even come down to examine him in person?
No, they must be backed up.
Or there's a July 4th sale at the BMW dealership.
Labs are back. Albumin's low, total protein's low. He also has megaloblastic anemia. Malnutrition.
Probably jail cuisine. Whitaker, what labs should we add?
B12, folate, iron levels.
Good.
Yeah.
We're gonna run some more tests, Mr. Varney. Hang in there.
I appreciate that everyone is, but I appreciate that she is treating him with respect.
Here you go, hon. I'll help you get on.
No bedpan. I can walk to the bathroom.
No,
and just
you
need a little
can't.
help.
You sure?
Hey, babe.
Oh, we got this, Mr. Hemler.
You'll have to bring your IV and portable oxygen.
Please?
Yeah.
I'll grab a wheelchair. Let's try to sit you up and dangle your legs.
Okay.
It's gonna hurt too much.
1, 2, 3.
Because the dangling is gonna... Yep. I knew it. I knew it was gonna
A
happen.
good idea.
I don't think we're gonna need this.
Sure.
Trying to give her a little bit of privacy
Yeah, it's okay.
and humanity. Dignity is the word I'm looking for.
Bedpan it is.
Yeah. I'm sorry, sweetheart.
You lose your pulse ox again, bud?
No. I knew it.
Louis. Louis. He kept pulling off his pulse ox.
It's on. It's at 71.
Louis, wake up.
I'm not getting carotid.
I got the airway.
Hey, Carla! Crash cart intubation tray, please.
Hurry. It's too late. It's gonna be too late. Please don't go. I don't have any tissues near me. So, that was season 2, episode 5 of The Pit. I'm a little bit more collected now. But, I have been worried about Louis this whole time, and I knew something was going to happen to him. I didn't want to be right. I don't know why Langdon was minimizing the patient with the leg. I can't even think of words now. God. I can't find the words. I can't think of really anything else in the episode. I feel like I need to make additional comment on. Normally I can talk for like 20 minutes after an episode. I think I'm going to stop here for now. Go take my dogs outside. And try to regain some composure to see what happens next. I hope Willie makes it. I hope he's okay. But I have no faith in that. If you enjoyed our time together, please subscribe, hit the like button, leave a comment below, tell me how you felt when you saw this episode. Do you feel like Robby is acting like a bitter ex? Were you as devastated as I am about Louis and concerned about Louis? And I am really annoyed with Santos. So, please leave your thoughts about the episode below in the comments. I will see you at the Season 2, Episode 6 of The Pitt reaction for 12 p.m. Thank you, and they call me Sour, and I hope you have a wonderful day. Bye.